Critical care is under a lot of pressure, and we're seeing younger and sicker patients and multiple members of families struck down by COVID. And the numbers that we're seeing are very concerning. There have been 57 new COVID-related admissions to ICUs in Ontario in the past 24 hours alone. If that's sustained or if that increases, it represents an extraordinary challenge to our healthcare system.
Services are being maintained, and that's through all of the hard work that you're doing. We're continuing to address bed capacity for COVID, and the activity at the adult sites is marked at being at over 100% and shows the stress we're under.
It will take a while until we see an effect on the ICU admissions because it's even more delayed than your hospital admission data. So we need to see over the next week whether we can bend this curve, which is right now the most important one that we have to get a handle on, because once the hospital capacity cannot catch up anymore, we are in trouble, and we all know that.
As of this morning, we were over 120,000, which brings us to 21% of the population in Hamilton has received a vaccination of at least a first dose. So we're starting to make good progress there, although of course, the supply is not where we would like it to be, and therefore we're not moving as quickly as we would like.
The Hamilton Public Health City Table has identified 2 pilots to begin in that highest risk population. Those are patients with severe kidney disease, and that pilot's being led by St. Joe's. And the second pilot is for the population of cancer patients who are in the highest risk group. Those are patients who have undergone a stem cell transplant previously or have had a type of blood cancer diagnosed within the last year. It's really important to stay tuned and up to date because the terms and processes for these are changing.
We're going to have the vaccine strategies rolling out by ages, by specialized patient populations, by essential worker populations, and then an inpatient hospital strategy. So there's lots of different lasers being fired to try and ensure we do our very best to get as many people vaccinated as quickly and safely as possible.